Imagine this situation. You're walking to work. It's a normal day, just like any other. You feel more tired than usual, and a little more confused, but you pay attention to it. So you're walking until, bam, you black out. You wake up, and you're in a room with a needle sticking into your arm, and your parents holding your hand so tight. You have no idea what happened. All you feel is tired, confused, and in a daze. You had a seizure.
Epilepsy is a neurological disorder caused by unusual nerve cell activity in the brain. Each year, about 150,000 Americans are diagnosed with the central nervous system disorder that causes seizures. Epilepsy is the fourth most common neurological disorder and affects people of all ages. Some common symptoms are staring spell, confusion, loss of consciousness, uncontrollable movement, and repetitive movements. Medications, surgery on small parts of the brain, and vagus nerve stimulation, which is an implant device in the chest, are some treatment methods that help prevent seizures from happening. Treatments can help, but it cannot be cured.
We chose this goal because there are approximately 65 million people in this world that are diagnosed with epilepsy. We have selected this goal because there has been deaths occurred by epilepsy each year, and some happens out of nowhere.
Our solution is the Detect Me bracelet. This bracelet is able to detect when someone is about to have a seizure. Detect Me alerts the patient that they are going to have a seizure so that they can find somewhere safe to lay down. The bracelet then notifies the nearest emergency medical care unit. Because the bracelet has a tracker in it, the emergency medical care unit is able to find out where the patient is in order to treat the patient as soon as possible. Detect Me is also a medical identification bracelet, so bystanders are able to see the bracelet and know the patient has epilepsy. Patients can also use Detect Me as a daily blog with their computers at home. Detect Me tracks how many steps you took that day and how much you slept. Once at home, the patient has the option of logging onto Detect Me and blogging what they ate or other activities they've done that day. This allows patients to look back and see what they did on a day a seizure occurred. By blogging, patients can see what those days have in common and can possibly find what triggers them to have the seizures.
This solution is so unique because it detects when you have a seizure, so you can rest somewhere instead of the ground. And while wearing this, you can find out what your triggers are instead of guessing whether lights, stress, or even sleep was the problem.
There is a bracelet which identifies that you are diagnosed with epilepsy. However, there are just bracelets that just signifies that you have epilepsy. It helps people tell that you have epilepsy, but how else does the bracelet help? They can be inadequate because they just identify you as a person who has epilepsy.